Hi, everybody. My name is Dr. Alexis Koskin. I am a public health professor at Arizona State University's College of Health Solutions. My whole research area is around preventing and controlling cancers that are caused by human papillomavirus. And so I've just compiled a lot of really great information, and I really thought that this was worth sharing. So here goes nothing. All right, so some facts about HPV. It is the most common sexually transmitted infection. There are over 170 different strains of HPV, about 40 which affect your genitourinary tract, and about 14 or 15 which are cancerous. There are two strains which are not cancerous but that cause the vast majority of genital warts. Those are called types 6 and 11, and again, they cause about 90% of these non-cancerous genital warts. They're not cancerous, but they do need to be treated. In the United States, 85% of women and 91% of men have a lifetime risk of acquiring HPV. So again, it's really incredibly common. Most people don't know if they've acquired HPV. Your body really doesn't show a lot of signs or symptoms unless you've developed these genital warts. The most common strain is HPV type 16. The reason why I really want to highlight that is that is a strain that that is associated with a lot of these HPV related cancers. Type 16 and 18 are associated with more of these cancers than, say, the other cancerous HPV strains. So it's the most common one that you'll find in the United States and North America. Individuals age 25 and under, actually more so like between 15 to 24 years old, are at highest risk for acquiring HPV. In the US, HPV causes over 30,000 cases of cancer each year. Those include cervical cancers and oropharyngeal cancers. That's a head and neck cancer. These cancers tend to develop on the base of your tongues, the very far back end of your tongue, and also on your tonsils. Precancerous signs may be detected by dentists and other oral health professionals. Going back to the other forms of cancer, anal cancer, vaginal, vulvar, and penile cancer are also caused by human papillomavirus. So this particular slide just shows you the various types of cancers that were HPV-associated cancers in 2015 alone. And the reason why I really wanted to include this is just to show you that HPV is a everyone's health issue, not just a women's health issue. There have been times when people have believed that human papillomavirus is really just a women's health concern. No, it's really an everyone's health concern. And actually, more men are being diagnosed with oropharyngeal squamous cell carcinoma. That's what that SCC stands for, oropharyngeal cancer that's caused by HPV, than women are being diagnosed with cervical carcinoma. So again, just thought this was a really important point to push through, is that HPV is an everyone's health issue. All right, so a couple different elements of natural history. So first of all, HPV is transmitted via skin-to-skin contact. Condoms can help reduce some of the risk for contracting HPV or acquiring HPV, but not all HPV infections, because we know that condoms don't cover all of your genitourinary tract. Oral contraceptives, while they might be helpful in preventing pregnancy, are not helpful in preventing acquisition of HPV. So just thought I would answer that because some of my students have asked that question of, hey, I'm on birth control, does that help prevent infection with HPV? No. Most HPV infections have no signs or symptoms. If you've acquired HPV type 6 and 11, you might have the symptoms of genital warts. But if you have any of those other strains, particularly the cancerous strains, there generally aren't many signs or symptoms. So people don't know unless women have gone in and had a pap smear, they don't know that they've been infected with HPV. So when people are spreading HPV, it's not because they're malicious and terrible. It's generally because they don't know they've been infected. Again, the low-risk strains called genital warts, those low-risk strains are called low-risk strains because they don't develop into cancer. The high-risk strains can develop into cancer. And again, women can detect HPV infection via pap smear, but there's really no test for men to detect whether or not they've acquired HPV unless they do something called an anal pap smear. Getting that examination is really uncommon unless you more often visit an infectious disease healthcare provider. There is a health disparity in who develops anal cancer, and it's generally those who are immunocompromised have a much, much higher risk for developing HPV-related anal cancer. So HPV can progress to cancer over time, but I want to note that if you see this slide, in each little arrow, your body and your body's immune system is really trying to fight off infection before it ever develops or progresses into cancer. So you could be exposed, again, via skin-to-skin sexual contact to HPV. In time, if your body has persistent infection, you might develop dysplasia, which is cellular changes on whatever site it was where you had that skin-to-skin contact. Over time, it might progress to a low-grade lesion that's non-cancerous. It might progress onto a higher-grade lesion that's a bit more that could be precancerous. And all along the way, your body's trying to fight off this infection. But over time, it's believed that this is the progression that leads to cancer development. The best thing to do to avoid all of these different stages is to get this prophylactic vaccine, the HPV vaccine, to protect yourself against some of the most common strains of cancer strains of HPV. So let's talk a little bit about that vaccine. It's believed that the HPV vaccine can prevent up to 92% of those HPV-related cancers that were previously mentioned earlier in the slides. So the vaccine that's commercially available in the United States is called Gardasil 9. It's 9-valent, meaning it's covering 9 different strains or types of HPV. The 2, again, which cause the vast majority of genital warts, and 7 strains, 7 of the about 14 or 15 that are cancerous. And that includes 16 and 18, those strains that are linked to the majority of cervical cancer, type 16, the vast majority that leads to oropharyngeal cancer, also anal cancer, etc. So here's the dosing schedule. If you're between 9 to 14, you only need 2 doses spaced out over 6 to 12 months. If you're 15 or over, or if you're immunocompromised, say you have HIV or you have a compromised immune system, maybe you're a transplant patient, or for some other reason your immune system is not up to par, you need 3 doses if you're under age 15. So by the way, it's important to note that health insurance covers this vaccine between the ages of 9 to 26. Now, in the past year or so, maybe like a year and a half, 2 years, the FDA has gone back and approved that individuals between the ages of 26 to 45 can get the vaccine, but health insurance plans all differ in who's actually covering this vaccine. By the way, there have been recent studies that have shown that just getting 1 dose of the vaccine is really entirely helpful. By the way, it's also important to note that without health insurance, you could pay for the vaccine out of pocket. I believe Gardasil 9 is going for about $230 per dose. So again, the best way to go is use your health insurance if you have health insurance and pay for it. I also have heard that the company that creates this vaccine has a patient assistance program that you could try to seek out the vaccine or coverage for the vaccine in that way. I know a little bit less, actually a lot less about that. Is the vaccine safe? Yes, the vaccine is safe. The most common side effects occur at the site of injection. That can include a mild pain where you get the vaccine, redness where you received the vaccine injection, and also some swelling. Where you get the vaccine is in your muscle, in your upper arm. People tend to remember this vaccine. It's a little bit more painful than, say, the flu vaccine. Some other side effects that may occur but are less common include a headache. A fever is pretty rare. There's something known as fainting, something that's known as vasovagal syncope, that's linked back to 3 different adolescent vaccines. By the way, this information comes from the CDC's website. Scientists don't think it has anything to do with the specific vaccine itself, but something about the vaccination process, that maybe there's some anxiety dealing with the process or the pain associated with the vaccine, and that increases people's risk for fainting. But this can be prevented. Fainting and dizziness can be prevented by having someone sit for 15 minutes after having received the vaccine. Also, another good practice is having a refreshment, whether it would be a liquid or whether it would be some kind of snack for people to have while they're sitting for the 15 minutes after they receive the vaccine. Is the vaccine effective? Yes. There have been numerous studies that are beginning to show signs of herd immunity, meaning even people who haven't gotten the vaccine have experienced the benefits from other people having had the vaccine. This particular slide, what this shows is the decrease. The vaccine has cut teen girls' infection rate by half. So the vaccine became commercially available in the United States in 2006, and it was recommended for girls, not boys at the time, for girls to get the vaccine, and specifically girls around age 11 and 12. They call it catch-up vaccination, that between the ages of 13 up to 26 to get the vaccine. Let's just to simplify this, let's just call it HPV vaccination. You can start seeing reductions, specifically among those age groups that were most targeted with the HPV vaccine. Over time, you see a reduction in infection, as identified by Pap smears, right? So following these people over time, you see a vast reduction nationwide in HPV infection rate in the age group that in which has been receiving the HPV vaccine. This vaccine has been so successful that continents such as Australia has aimed to eliminate cervical cancer by years as early as 2028, as late as by 2035. They want to have less than 1 per 100,000 women develop cervical cancer, hopefully leading towards elimination with time. Should you get the HPV vaccine? As a public health professor, again, I have no reason to promote this vaccine except for the fact that I study how to prevent and control HPV-related cancers. I think yes, absolutely. The pros vastly outweigh the cons. Yes, there may be some side effects. Again, pain at site of injection, redness, maybe some slight swelling. The other more systemic side effects are a lot less common, but they could happen, so I had to tell you about them. However, to prevent having women, not having women, but women having an abnormal pap smear and trying to navigate what that means, and the anxiety of potentially having an abnormal pap and having to go back for a colposcopy, for a tissue sample to test whether or not it's progressing to something that needs to really be watched so it doesn't progress into cervical cancer, to prevent that risk of developing HPV-related head and neck cancer, to prevent those other cancers, and to prevent genital warts. This cancer prevention and genital warts prevention resource is invaluable, and I highly recommend at least getting 1 dose of the HPV vaccine. So again, that's just the latest research that's being presented. I hope that you've enjoyed learning more about this. Thanks for your time, and if you haven't gotten it already, or if you've got family or friends that need to get the vaccine, again, I highly recommend getting it. Have a great day, and thanks so much. Here are a list of the references in the case that you wanted to learn a little bit more about what sources I used for this presentation. Thanks, and again, have a great day.